Hello. Did you know that millennials will make up 75% of the workforce by 2025 and they have a spending power of $1.4 trillion? Did you also know that premiums rose from 2008 to 2018 by 75%? And in 2019, a single premium cost over $7,000 and a family premium for health insurance cost over $20,000. Almost 100 million employees of the 156 million people in America are covered by self-insured programs. And in 2018, employers were looking at ways to reduce cost because they spent over $530 billion on poor health. So this is a tremendous untapped market for people. Millennials are disruptors in the healthcare system and the workforce. Hello, my name is Cindy McDaniel, and I have the solution to this problem. It is called Total Health Partners. Total Health Partners is a holistic services model that's designed to meet the millennials' health as well as the employers. It's designed around technology, virtual health, as well as aligning it with a mix of physical engagement, which is really important to this, and it's offered in a retail setting. So what makes Total Health Partners unique? Well, first, it's a model that reduces employer-employee cost. It promotes engagement among millennials to identify chronic disease and manage it on a long-term basis. It manages claims at the front end. It helps establish a culture of health among within the business, and it creates an investment in human capital. It also meets the benefit needs that millennials are expecting from their employers, and it provides the preventative care that reduces claims long term. In addition, it creates, the company can provide an overall health grade for the company as well as for the employee. And most importantly, it is not insurance. The strategic plan for Total Health Partners is to convert an existing physician practice into the Total Health model. And it's going to be designed to create a 30% reduced cost for healthcare for the businesses. And it's designed to help businesses improve their attendance as well as their, for employees' impaired performance and economic losses. The price point is going to be $10,047 per each employee, and it will help the business establish how to purchase the appropriate stop-loss insurance for catastrophic medical costs that they may incur. The vision for Total Health Partners really is to develop a new health delivery model within the health ecosystem that helps businesses invest in human capital and reduces their reliance on insurance. It's designed to create a healthcare model that focuses on cost containment for the employer and the employee with a high level of engagement. And it's designed to promote promote the brand in the future as a franchise. Now, the mission for Total Health Partners really is to shift the delivery model from the insurance management to business management to improve care and efficiency. And to do so, we need to partner with self-funded organizations to provide a convenient, innovative, and engaging care model that effectively manages 80 to 90% of the healthcare issues, both virtually, physically, by utilizing 3 of the pillars of health, which is physical, mental, and nutritional. The goal of Total Health Partners really is to empower employers to improve the lives of their workforce through engagement. It's known that 80% of the millennials are seeking more provider engagement, so this meets one of their needs. And to establish a millennial brand loyalty in healthcare and meet the needs and expectations of millennials in the workforce. Plus, Total Health Partners will work with the business to promote health devices, apps, platforms that can be given through the business organization. The risk assessment and mitigation for Total Health Partners, we look at a couple of different risks that we encounter. First, it's strategic risk, which this is a new direct delivery model that's competing against risk management and third-party administrators in the area. But to mitigate that risk, we're looking at partnerships with health professionals experienced in managing capitated reimbursement rates with positive outcomes. The operational risks are really, those are risks that anybody would be addressing with key staff members, staffing shortages, cyber attacks, supply chain, process controls, quality outcomes. And to mitigate those risks, we really have things in place such as our um, key managers, which would be our physician. We do have insurance on that key position, as well as backup vendors and staffing agencies should we need to utilize those. And we also have policies and procedures in place to support those. Now, from a financial standpoint, those risks are managing medical costs within that capitated rate, price negotiation with network providers, as well as labor costs, our fixed assets, and other expenses that are involved, whether it be cash flow, interest rates. And to mitigate that, we're looking at customer research to determine which businesses we want to take on to reduce that through the health assessment plans that we offer, the outcomes, and the financial controls. So when we look at our compliance risks, those really aren't no different than any other health provider. And that's looking at our legal and regulatory guidelines, local, state, and federal guidelines. And to mitigate those, we have policies and procedures in place to ensure ongoing compliance and review of those policies and procedures on a regular basis. Motivating and assessing employees at Total Health Partners will be one of the things that I will enjoy the most. I have a background in HR and I love building teams. It is something I feel like that I'm very good at. I've done it over the years by utilizing a series of goals. If I found that if you communicate your vision and you communicate your mission often enough and you specify that to your employees, you will see that they can meet and achieve anything. And I utilize management by objectives often. I actually do that, and initially I give people goals from the very onset, and they're specific, measurable, attainable, and relevant. And we usually have time frames, and we look at that every 3 months, every 6 months, or over the course of the year. The more often that I found that you talk to people, the more often the better that they're going to be at achieving those overall company goals. And it can be fascinating to see the growth. They get excited. And it's one of the things, I think building teams is one of the things that really can make a difference in how successful your company is. As part of the plan of operations, these are our key services and exclusions. And you'll notice through here, if you'll look throughout, you'll see many of these are preventative services. We offer the labs, the physical therapy, sick visits, 24-hour on-call, mental health counseling. We'll offer x-ray in the second year. We'll contract that in the first year. Therapy for workers' compensations. We can do all the general things that a primary care physician would do in the office, but we also go the extra mile in terms of coordinating surgeries and trying to negotiate price points for the company. Although we do have those services excluded in our per diem rate, which is like cancer treatment, major surgery, or hospitalizations. Part of the marketing plan, we conducted a SWOT analysis for Total Health Partners, and we looked at the strengths, weaknesses, and opportunities that we have in this area. And our strengths really are the growth model for the future to control cost. I really think that this is on the forefront. And there's no competition, and there's certainly not a niche in this market within the Roanoke area. And as some of the other strengths is it incorporates preventative care. It's cost effective for employers and employees. And Total Health Partners has an established medical director that's well respected in the area. And it really promotes millennial engagement, which is something I think many health providers are not focused on. So when I look at the opportunities for Total Health Partners, we have some unique opportunities on the forefront, which is, the government regulation, which is HR 3708, clarifies that direct care providers it's not an insurance plan, and that kind of separates it so that we can actually work and bill for what we're doing. And it allows the use of health savings plans, which of course in this situation is not going to be necessary, but they could be used for other things because the way it will work with the company is it will be paid to us much like insurance. If the company wants to take money from their employee and then they pay the difference and pay it to Total Health Partners on a monthly basis, that will be how that monthly membership works. But CMS right now is starting to recognize the cost savings of your direct primary care providers and that they can really reduce the total overall cost. Therefore, they're rolling out some direct reimbursement models that's going to be coming in 2021. So I see this on the forefront of things that may be changing, and it's an opportunity for sure to establish a new model. And of course, it meets the unmet millennial healthcare needs that people tend to be more focused in this area on the baby boomers. Now, as far as the weaknesses go, there's really no historical outcomes data beyond the direct primary care model. Although, as I said, CMS has already been looking at this, so there obviously is some actuaries that they've looked at to determine that it is more cost effective, which is why they're promoting preventative health. As far as the other weaknesses, it will be establishing the first contract. There again, that should be done ahead of actually trying to start implementing the business. And it does not provide the multiple provider choices for care. So therefore, we'll have to educate the businesses as well as the workforce. However, from my research, I found millennials are fine. They are expecting their employers to provide some of this, and they look to be they want to be more engaged with one employer. So it may actually be a positive. Now, when I look at the threats for our area here, it's emerging competition, our competitors. Our biggest competitor will be Carilion Clinic. They have their hands in everything in this area, and they have purchased most of the primary care physician groups in the area. Now, they've left the niche markets alone. However, they are a self-insured company themselves with over 10,000 employees. So they may very well attempt to replicate this or enter into this niche market with future physician groups adopting a similar model in the area. So I look at that as a potential. I also look at the 2020 pandemic. That's certainly a threat from a national level because Total Health Partners is reliant on one primary physician going into the startup. We're looking at the PPD supply costs that may still linger for the future or the availability with supply chain. And we also look at the insurance industry, which may in the future, as this market rolls forward, they may be trying to have some backlash there because it will be taking business away from them. So we also look at the fact that we're in an economic downturn at the moment. Is that the best timing to do a new startup? Because that you have to grow businesses. But the way this model works, I think, is we are really focused on working with a business or a company that has numerous members versus starting up and trying to have a direct payment with people just from the public. And it can take much longer to grow that. So the cafe, the other threats that we see is the cafe and the gym. They all have very, very tight margins for profit, and we have to consider that as we are doing the startup part of it on that, and that's very competitive, and we need to have that money to support the 250. Now this slide shows the break-even point for the member contracts. Plus, I also showed what we would be making on the service contracts that adds to it. So you'll notice for the first year down here, we had one contract with 250 members, and our break-even point is one contract with 360 members. However, we made that up with some service money, which was that's represented right here, which is the $216,000. So our capital investment is at $550,000 the first year. We moved over some capital equipment purchases into the second year, which would have been the X-ray machine and the app development into that year. But you'll see the second year we moved up with our members as of 640 members. That was the second contract that was added. And then the third year we were anticipating one other contract with 300 members. And so you can see that it goes up to 940 members total. And as we grew with that, you can also see where we have grown the services in the other areas, which really are designed to support themselves. It's designed to promote it for the millennial workforce. However, each department should be able to financially support that department by itself. Thank you for allowing me to present this exciting business opportunity. I really do believe that it is a new healthcare revolution, presenting a model that meets all of the needs and expectations of healthcare in the 21st century. I have emailed the business plan for you along with supporting documentation and my contact information, and I'll be happy to answer any of your questions.